Okay, hello everybody and welcome to today's live seminar. Today is Friday, April the 3rd. So many of us are wondering where March went, but most of us are really excited March is gone, but we might be scared about what April's gonna look like. So, it's no doubt to everybody, no surprise I should say to everyone, that we are in the middle of the coronavirus pandemic. And a lot of us are trying to figure out how we navigate that. We've done webinars for the past couple weeks, and we'll continue them. And really, they're focused on specific questions, specific themes that people are wanting help and assistance with. And we've seen the range from older adults, adolescents, middle-aged individuals, millennials, you name it. And we've really kind of ranged on what we've talked about, from anxiety, OCD, depression, ERP that's specific to this time. But as always, you can submit any questions that you have. It doesn't matter if they seem off topic. Please feel free to do that in the live comment section throughout today's seminar. Today, I am so excited. My coworker, Dr. Alejandra Sequeira, is joining us. And Dr. Sequeira has background in OCD, eating disorders, children, adolescents, and adults. She's our go-to person at our clinic for most of our child questions, adolescent questions, OCD, eating disorder, kind of you name it. She is fluent in Spanish. And so we are so lucky today to have an OCD and anxiety disorder specialist who not only specializes in a field that's very limited, right? We know there's not a lot of us that do the work that we do, but that is also bilingual, because we know OCD and anxiety doesn't affect just one population, right? It affects 3% of individuals globally. Really onsets, usually child and adolescents, boys younger than girls, but it is one of the most chronic mental health conditions. The more we can create opportunities for access to care and speak about how we can appropriately help children, help adolescents, the better off they'll be. So thank you, Ali, so much for joining us. We're excited to have you here.
Thank you for having me. I'm really excited to get to participate and read the questions and answer and provide any support that I can.
Wonderful. So why don't we just kind of get started with a little bit of a brief introduction, if you want to share kind of what your background is and why you do what you do.
So I've kind of gotten a really great opportunity to work in a variety of different settings. I love working with children and adolescents, and so I got to have training in a child advocacy center. So I worked a lot with children who endured a traumatic event, experienced abuse. I've also worked in the hospital settings, like you mentioned, with individuals with eating disorders, as well as teens who are working on their wellness. So individuals who had health complications due to their weight. And also gotten an opportunity to work as a consultant in a pediatric clinic where I did wellness checks, autism screenings, and kind of provided support for kids with ADHD, also anxiety. A lot of medical procedures can be really scary for kids and teenagers alike, and so I got an opportunity to work with them as they overcame their fear of needles, fear of blood, to do a lot of necessary procedures. And through all of those different experiences, I really just loved working with teens and adolescents, and I loved helping them identify what are the things that are getting in the way of them reaching their goals, and then helping them navigate ways to get around those barriers. It's really rewarding work to kind of get to see somebody at the end of a really scary experience and kind of celebrate with them. People are always so proud of being able to reach those goals, even if it's just getting a shot or being willing to talk about your anxiety or your depression. So that's kind of a little bit about my background. And I'm also bilingual, so I've gotten an opportunity to provide therapy in both English and Spanish. And I am so lucky that I am in a position where I can provide both of those services in both languages, because OCD specialists are pretty limited, and OCD specialists that can speak Spanish are even further limited. I'm a huge believer in trying to knock down any barriers that we can to access to care. And that's a really huge passion of mine. And so I'm really excited and passionate to be able to do anything I can for the Spanish-speaking population as well.
Absolutely. And we're grateful for you. I know that the International OCD Foundation and Peace of Mind both work tirelessly, right, to try to increase resources and support for people with OCD. But we know language barriers is a huge kind of stop point for a lot of people being able to access appropriate care or treatment, or even just the psychoeducational portion, right? If you go to a lot of our websites, there's a ton of content, but most of it's in English, right? And I think we're trying to work on that and trying to change it, but we are grateful for those of you that work every day making a difference in that field. So thank you for that. So let's hop into a couple kind of themes that I want us to kind of introduce first before we jump into questions. So the topic and title of today's presentation is how isolation affects children and teens. And I'm curious, Allie, when you were just speaking about your background, it got me thinking that you've probably had experience in this for a long time before coronavirus because you worked in medical settings. So one of the things we've heard a lot of is patients who have cancer, patients who are immunocompromised, right? A big response right now to what the world's going through has been, okay, well, I've been living in isolation for years, right? This isn't necessarily new to me, and this is how I've had to, or how I have to live my life all the time, right? Because interactions can become very dangerous for them. And so I'm curious if you saw that in the past and how you kind of back then compared to now, but like how you helped manage anxiety around children and parents of, can they go out? Can they interact with people? What will this be like? How dangerous is it?
Definitely, yeah. You see that a lot in the hospital setting. And we also know from research too that social isolation, especially during your adolescence and childhood, can have lasting effects on your mental health, your physical health, self-confidence, academic achievement. So it's a really important topic that we kind of consistently need to continue having the forefront of our minds. I think technological advances have made decreasing some of the social isolation a little bit more easy than in the past. I am a huge believer in trying to activate your child's social network virtually as soon as possible and as frequently as possible. So that may mean kind of loosening some of the restrictions that we put on screen time or social media use, because that is a really great way for kids to really stay in touch with their peers and get that ability to interact and kind of develop themselves socially. And also get a break from having to be in the hospital all day and having to talk about your medical problems, to be able to talk to somebody who isn't a doctor and telling you like all of these really scary things that you need to do. So that I've always encouraged trying to plug into online support groups, doing Zoom chats with your friends. If you are an active member of the Girl Scouts, like try to get part of your Girl Scout troop together and work on a badge where all of y'all are getting to do the same science experiment or something like that. But it's a way that you can participate in that Girl Scout meeting without actually having to be there.
Yeah. And I think, it's interesting because I always talk so much about treatment for OCD being twofold. I'm a big believer that treatment's critical, right? None of us would do the work that we do or be in our field if we didn't believe in it. We didn't know that it worked. But as a patient with OCD, I also talk very openly about how important it is to have an OCD community, to have somebody else that you can talk to, right? When I was in the throes of my illness, my parents tried their best. They loved me, they cared for me, but they couldn't understand what it was like because they don't live with OCD. And so I always tried to make an effort to, and I always still try to make an effort to encourage people to meet someone else with OCD, right? Meet somebody else with anxiety, meet somebody else that has a similar struggle that you do, because you can relate. And the beauty of it, I will say right now, is that finding that person in the real world, in your school or amongst your church or whatever it might be, is really difficult, right? Because like, how do you navigate that? How do you walk through and say, hi, I'm OCD. Does someone else have, I have OCD. Does anyone else have OCD, right? You're not going to do that. But being able to actually find those groups online is pretty easy. They exist everywhere, right? And it's pretty simple to find someone else with a similar struggle. How important do you think that is?
Extremely important. I think especially for adolescents, as we're going through middle school and our bodies are changing and we're kind of going through puberty, the last thing we want to do is be different from our peers in any way, shape, or form. And that can cause a lot of internal distress for a lot of kids because they have anxiety or they're struggling with depression, they're struggling with OCD, but it's really hard to want to share that with anybody, or kind of working overtime to kind of hide it from people because you don't want to be that weird person, or you don't want to be opening yourself up to bullying or to other people's comments and things like that. So I think it's really important. I always advocate for children and adolescents to find other people who do understand what it's like to have OCD, who do understand what it's like to have anxiety or to struggle in the same way that they do. It's incredibly validating. And I think it also kind of opens the door for the rest of their lives to kind of have a greater sense of acceptance and peace with their OCD or whatever struggle they're having, because they were able to kind of plug in and realize, like, I'm not weird. Like, this is something that other people struggle with, and I don't have to be ashamed of this.
Absolutely. And I think that one of the things we find all the time is that people are really struggling with finding that person. And I just want to point out, the International OCD Foundation is now hosting children's support groups once a week in the evenings. And I think that's so exciting to have it. But I also want to just talk for a second and allow you to talk for a second actually about stigma and what it might look like, and I think for everybody, engagement is different. For some of us, we might want to join that support group, but join it with our camera and mic off because we want to hear for a couple sessions. And then maybe we're willing to turn our mic on and interact, and then maybe eventually our camera. But what are your thoughts on that, and how important is it for people to understand you don't have to fully show your face, give your name, and be identifiable, right? You can do it at your comfort level.
I always encourage to kind of almost take like a hierarchy approach to getting involved in some of these support groups. So maybe at first you just watch any webinars that have already been recorded and are put online. Maybe go through social media. Instagram is a great place to get plugged into providers who are giving mental health tips. So individuals who have OCD or anxiety who are sharing their story and sharing ideas and tips of what has been helpful for them. And then slowly kind of start, like you mentioned, joining but not having your camera on, and then kind of really systematically working up to being able to participate in whatever capacity that feels comfortable for you. And for some people, getting plugged into online support groups isn't as important to them as being able to share their struggles with their church group or with their peers. I've actually really gotten a lot of positive feedback from kids who like really set the goal of wanting to share their story with their peers and do so in a way that's educational and to help take away some of the stigma. And so I think that is really empowering to see other kids do it, and that helps you feel like you can kind of carry that torch as well in your own school.
100%. And I'll, if it's okay, share a little bit about you and I. But I know Allie and I have talked about how we both really enjoy some of our exercise communities, and the ability for both of us, we've talked about like, oh, it's so great when they're doing this online content because you feel like you get to connect with your community. And so just because you want to share your story, it doesn't have to look the same for all of us, right? For many of us, again, it is our church community, it is our close friends, it is our family. And what I hear over and over again is whether someone writes a blog or they join a support group, however they connect, that it's usually always meaningful in some way. Right? You might not get the reaction you want from everybody, but typically, at least in my opinion, when you get the reaction or a reaction from one person who says, thank you for sharing your story, I'm now willing to share mine, or I had no idea, I also struggle with this, right? It makes it all worth it. And it really validates, for me, that kind of slogan I always say, which is giving a purpose to the pain, right? It makes us feel like, okay, there's meaning or purpose. So tip number one that you've shared that we've kind of talked about is find a way to plug into your community and find a way to connect with others no matter what you're going through, right? So some of us have 15 communities right now that we're dealing with virtually, right? Family members, friends, book club, Bible study, OCD support group, whatever it might be, connect with your different communities because it's absolutely critical. So let's talk a little bit about depression and isolation specifically. So we know, right, as providers, the number one thing we always tell people when they're experiencing depression is don't isolate, Right. We know that isolation, especially the kind of the isolation that happens in our room, in our bed, where we're sleeping all day and kind of avoiding life and interactions, it's just going to increase depression and increase symptoms overall. Well, we're in a world right now where we're being told all day to isolate, right? To isolate and to not interact with other people and to avoid interactions at all costs if you can. So how can parents, caregivers, loved ones, how can they encourage their children to not isolate when they know their children may be susceptible to depression and anxiety during this time in this era?
Definitely, that is a really good point. I think right now avoiding contact with other people is so easy to do, and it's actually like we're being rewarded for doing that, and that is a double-edged sword. While it keeps us safe physically, it also is encouraging us to engage in unhelpful coping strategies. So I will recommend to parents to keep as much of your daily routine as possible. This is really important for sleep, for exercise, making sure that school is a priority. So setting aside those 8 hours for something educational. Also modeling the behavior you kind of want to see from your kids. So if you're always in your room, or you're always in your den, or you're always like unavailable to them, then you're basically kind of modeling that isolation from other people is okay. So family dinners are a really great way for everyone to kind of check in at the end of the day, to have an open discussion about your thoughts and feelings about everything that's happening, either just in that one day that you had or in this kind of crazy epidemic that we're all having. But being able to model that to your children of saying it's okay to be scared, it's okay to feel sad about this. I think highlighting the altruism aspect of isolation can be really helpful too. Giving back to others and doing good deeds has been helpful for fighting depression, because if we're helping others, and we tend to feel good. And so kind of framing quarantine as a way that we're helping everybody stay safe can sometimes help bring in some of that altruism that kind of really helps us feel good and can combat some of the depression that we're experiencing. But
Yeah.
have family game night and let your child pick what game you're going to do, or a family game or family movie night. Let the child really kind of get invested in those activities and get to pick what they want to do, so that way they have more of a desire to want to participate in that.
I love it. I think that one of the things I've been telling people is that, while we are isolating, we can also make an intention to be more connected to people than we've ever been. The opportunity now that we have to be able to take time to call our grandparents, to call people who we might not always have time cut out in our day or available to do because we stay so busy, we can do that and feel connected, right? Connection doesn't have to be traditional, because right now nothing's traditional. So we have to be creative. And I think the helping and giving back is critical. And I can't say that enough. I know for me, especially with my OCD, I have found that the more I speak out, the more I give and I help, the more I can understand maybe, okay, there's a purpose to my struggle, right? Maybe I'm meant to help other people despite what I've had to go through. And so my call to action for all my young kiddos and adults right now is help an elderly loved one learn how to use technology, right? You can do that from the comfort of your home, but you can walk them through. It might take a while and get frustrating, right? But you can walk them through how to use an iPhone, how to use an iPad, things that would allow them to then be connected. And I bet you'd feel really good about it, because afterwards, your grandparent, your loved one now can have connections that have been taken away from them. So I think helping others is critical. One of my other tips that I want us to talk for a second about is one of my favorite little quick reads that I talk about often is Make Your Bed Every Day. And it's an amazing little book, because really what it's about is that, there's a simple task like getting up in the morning, opening your blinds and making your bed that sets your intentions for the day, right? And it's something that we can do every day. There's nothing that stops us from doing it. But often what we find is that when we get up and make our bed, we've already had an accomplishment. So no matter how many other things don't go the way we want throughout the day, at least we have a good accomplishment that at night we also get to come back in our room and feel good about it. And so I wonder if you have any similar tips for kids and adolescents. And you talked about this a little bit of really the importance of parents encouraging a similar schedule and allowing them to not get too disrupted. And again, I think making your bed, that's also a great thing parents can model. But how important are things like letting the light in, making your bed, getting breakfast at the same time, sitting down at a certain area to do the schoolwork versus doing it on the couch? How critical is that?
I think it's incredibly important. We can all get into pretty bad habits pretty quickly. And the more we allow ourselves to do homework on the couch, for instance, or kind of get out of that routine, the more we're kind of fueling procrastination and avoidance, which are two things that we really want to be aware of. But also, we feel good when we get up and we get dressed and we put our makeup on and we do our hair. And I always emphasize that it's important to do those things for yourself, not for anybody else. So you're doing your hair and makeup because you know that makes you feel good and that makes you feel confident. And even if no one else sees it, you're still making sure that your health, your well-being, and your confidence are number one. I think it's also really important to kind of take this as an opportunity for an adventure. I think all of us get so busy throughout our lives that we'll say, oh, I would love to do this Pinterest project, but I just don't have time. Or, oh, I would love to learn how to play the piano, but I can never do that. You have nothing but time now to do those things. So maybe having your child make a list of all those things that they keep saying they want to do. Maybe it's cleaning out their room and getting rid of all the things that they don't use anymore. Or again, like working on the Pinterest project, or maybe trying out new recipes and things like that. Kind of trying to find that excitement in each day, and setting goals is also a huge tip that I have right now. Is it's important to kind of keep moving forward. So maybe your goal is that I'm going to reach out to 3 friends today, or I'm going to make my bed and make sure that I at least get out of my pajamas today. Those kind of things are all going to kind of add up. But I really encourage you to get out of your pajamas, because that helps you feel a lot more productive during the day. And also, I'm going to really stress, it's really important to not make your bed your catch-all place. We have such a tendency to make our bed our dining room table, our workspace, our video game space where we unwind and watch TV, and that actually can contribute to really bad sleep hygiene. And so right now it's kind of really important to make sure that you get out of bed, make your bed so you're less likely to want to get back into it, and at least spend the majority of your day outside doing things. And exercise, being outside as much as you possibly can, is really important as well.
And I think parents have experience with this, right? They talk about that on weekends in the typical school year, they like to keep a similar schedule, because otherwise Monday morning is a nightmare with their kids, right? Trying to get them up for school and get them back on a schedule, versus if you just keep it, that consistency helps everybody in the whole household. And the reality is that most of us as adults, not most, but a lot, are working from home right now, right? So you're still having to get up and clock in and see your patients. If you're a provider, you're having to do your work, whatever it might be. And so having your kids on a similar schedule is critical. And again, this is where that kind of setting your intentions, getting dressed in the morning, right? Your dress might not look the same. Like, I'm not going to lie, I often wear yoga pants right now, but I still have a nice shirt on or things like that. I might not be in full slacks and heels because that's not needed. But the reality is like pajama pants and not showering and not getting ready for the day just continues to set the example that, like, I'm not really doing much today, right? Like, I don't really have a plan. And so let's talk a little bit about your last word you just shared, which is the importance of setting goals. And let's talk for a second about OCD treatment specifically. One of the things we see people do all the time is, well, my goal is to have less OCD. My goal is to have more freedom. And our response is usually like, well, what does that mean? Right? If I were to say my goal is to wash my hands less, what is less? Is less, 10 hand washes a day? Is it 100 hand washes a day? Like, how is it going to be measured? How important is it that SMART goals are used for OCD, anxiety, depression, all sorts of mental health conditions, but also just everyday living right now?
It is incredibly important. There is a ton of research that supports SMART goals. and how they lead to more progress for us to actually do purposeful, committed action towards the changes that we'd like to make. I often tell my patients who say, like, I'm going to try harder to work on my OCD. I'll say, what does that look like? What does trying actually mean? Because I could say I'm going to try to go to the gym and put my yoga pants on. Does that count? And usually they'll tell me no. So it's kind of being able to use that as like an example of why it's important for us to set those goals. Because if we're saying, I'm just going to try this, then we kind of almost like are already giving ourselves an out to not actually do it. So if we set a goal of saying, I'm going to work out for 30 minutes, 3 times a day. If it's raining outside, I'm going to go inside and do a yoga online class or something like that using this website. Then you have more of a plan. There's kind of more of a structure. You don't have to spend time during the days that you want to work out trying to figure that out. And you kind of cut out all of the opportunities for you to find reasons not to do it.
Yeah, it's specific, measurable, and attainable. And, I think the really important part is that goals should be shared with the family. And again, this is where modeling comes in, that if parents, you're also setting goals and making those clear, and then we're rewarding ourselves, right? We get ice cream or whatever it might be if we all meet our goals. Those things are still possible. One of the research I've done a long time. Oh, sorry.
Oh, no, I was going to say, as you were mentioning that accountability, I am huge on doing challenges with your smartphones, with your smartwatches. My family and I are all challenging each other, and that is a great way to just get up, set the intentions of making sure that you're standing up and being active throughout the day, and kind of being able to cheer each other on. So after you finish a workout, you're going to get a bunch of text messages from the people who care about you, who say, great job, like, awesome, like, I feel so inspired by you. And then it just makes you feel better and gives you that positive feedback. So if you and your family can create any sort of kind of challenge like that, it can be really a really great motivator to get up, keep doing your chores, keep doing the things that you want to do during this time.
Yeah, it's all about accountability. I think as adults, we're accountable at work, and we have deadlines, and that's, and most of us, while we might not always love the current deadlines, but we appreciate them because it keeps us on track. There's a requirement that we've got to get something done or turn something in, and it's the same with kiddos, right? They need accountability, and I think right now parents are feeling totally overwhelmed. They're having to be a teacher, they're a stay-at-home mom, they're an employee, they're all these roles in one stay-at-home employee that they never expected to be, and simultaneously they're trying to take care of themselves and their kids and feed their family, and they're trying to figure out, how do we juggle it? Well, we also juggle it by working together versus one person holding all the roles and holding all the work. And I think the more you can do challenges and accountability tools and ledgers and charts and stickers, right? Now we all get to work together, and the kids are just as excited to meet their goals as the parents are to meet theirs. The other thing I wanted to say is that research has shown us that, like, the benefits in eating dinner together as a family, right? We know that it really increases a lot of great things, and it decreases a lot of negative things, right? And we know that it's a really, really valuable thing. Most of the research shows that about 3 family meals together are where we see the best outcomes for increasing mental health in a positive way and decreasing addiction and different negative activities. But the research that I thought was so interesting of this is that if one person is using technology at the table, all of the benefits are washed away, right? They're gone. And one of the things I want us to talk about for a second is 2 things. One is technology overload right now. We are using technology more than we've ever used in our lives. I've never seen so many people on Zoom than I have the past couple of weeks. And it's great. It's a wonderful technology opportunity. It's a great way for us to get to connect, but it's also a lot. And sometimes I need to just disconnect from technology and get back to reading a book or sitting with people I love at a dinner table and just having a conversation. And so I want us to talk for a second about how families can unwind in the evenings and disconnect a little bit from technology, but also how, where again, the same theme we're hearing, right? The modeling has to come into play. I can't tell the kids and my little sister to put their phone up, but if I'm using my phone at the dinner table.
Definitely. I can't remember who said the quote, but it's always stuck with me, that who you are is so loud I can't hear what you're saying. And that is a really great reminder for me to always make sure that I'm practicing what I'm preaching. And growing up, we had family dinner every night. No one was allowed to be on their phone. And mind you, this is before like smartphones were a thing and like cell phones were big chunks and stuff like that. But my parents have always modeled that for us. And as we've gotten older and have had more access to technology, that rule is still the same. So anytime I go over to my parents' house, if I'm there, they will take my phone away from me. But they also are off of their phones. So I think that that's kind of setting those very strict rules around dinner being the time that we are not going to be on our phones. And mom and dad have to kind of model that as well. And maybe having like a time at the end of your day where we're just cutting off all of the technology and we're all going to be doing something that isn't technology related. Yeah. So maybe at 8 p.m. or 9 p.m., depending on your child and like bedtimes and things like that. Do that as a family. There's a lot of family charging stations. And I see teens that are actually way more willing to comply with this rule if everyone has to put their phone on that docking station, mom and dad included, and no one is allowed to touch them until the next morning. Kids are going to buy into that so much more if they know that it's something that the whole family is doing. It's going to feel less like an attack. You're probably going to have a lot less pushback from your teenagers, but also just having a good list of things that you can do that don't require technology. So having books that they like, puzzles. I am such an advocate for visual reminders, and so maybe create that list as a family of things that you can do, and either encourage everybody to work on that, or say like every day we're going to work on one of these tasks as a family, and can figure out like a way to kind of make that selection. But I think that modeling the behavior we want to see from our kids is of the utmost importance for any restrictions of technology to be beneficial and to stick.
100%. And I think, one thing we're hearing over and over is kind of this anxiety with parents, especially around the fact that sports are canceled. A lot of their children, while it was a busy life to drive back and forth, right? For parents is kind of that has slowed down. But oftentimes activity was how kids got their energy out, right? So by the time you get back home, we're able to relax or spend time together. How important is it that parents still find activities and ways for their children to engage in physical exercise to release some of that anxiety?
So important. Making sure that you're keeping everyone safe and abiding by the social distancing rules and stuff. I'm going to encourage daily exercise. Outside activities is huge. There's a huge challenge that's kind of going around that's really cute. It's called Going on a Bear Hunt Challenge.
Yes.
And so this is actually really fun for me as well. Whenever we go on a walk, we see all of these bears that are in people's front yards or their front windows. And it's really fun to kind of go around and see how many bears you can find. So kind of researching activities like that can be really helpful to keep that physical activity new and exciting for your children. Because realistically, you're probably going to go on a walk in your neighborhood, and that can get monotonous and boring pretty quickly. So doing challenges like bear hunt or playing a nice spy game while you do it, encouraging bike time. There's a lot of really great outdoor games, and some of them are so simple where there's 2 poles and you put a cup on top of it and use a Frisbee to try to knock off the cups. Yeah. There's so many ideas that are so easy to do. You probably have all of the equipment that you need to at your house, but being creative and, again, modeling that behavior. If family's going to go do a bike ride, we're more likely to want to do that than if like you're telling your kids to go outside and then you're not doing it.
Doing it with them. Exactly. And I think it's interesting. It's like we've gone back to the basics, right? We've gone back to these like basic activities that people don't do anymore, but there's still joy in them, right? And the joy is that we can connect, we can be together, and we can be present. And it's important for all of us to be present, not to have an expectation that one kid's going to be present, but we'll be doing our own things. So let's hop into kind of the last question that I want to make sure we touch base on, which is, how we talk about coronavirus, how we talk about what's going on in the world with children and adolescents. In particular, it'd be great for us to think a little bit more about how we have these conversations with kids who already have anxiety or an anxiety disorder, and what that might look like. You know, I think we clearly all feel strong that we don't want to lie, but we also don't want to oversaturate and give them information that they can't process appropriately. We did a webinar with Dr. Perry, who is a child trauma expert, and a couple weeks ago, one of the things I loved that he talked about is he said, you know, what we have to understand is that when we hear a story on the news and it talks about how maybe it says an 80-year-old Houston resident passed away from coronavirus, we might hear that same kind of excerpt said 30 different ways, 30 different times throughout the day, and we understand what it means. Okay, someone from Houston passed away that was elderly from coronavirus. But if a child hears it 30 different times, 30 different ways, Dr. Perry was talking about how they actually think it's happened 30 different times, right? They don't have the same cognitive skills and ability to process it that, oh, this is the same story that's being repeated. We know that news and media repeats, exasperates, exaggerates, right? All of these stories tremendously, and it causes undue anxiety and stress. So what are some tips about specifically around how parents can talk to their children about what's going on? And then what level should they be sheltering them from the news and consumption of information around coronavirus?
So I definitely think limiting the talk about coronavirus and news coverage of it is going to be really important. So maybe limiting yourself to only watching one news report throughout the day, and there's not a lot going on in the world. All the news cycles are probably going to be very similar. So if you're able just to really kind of keep that limited and not have the news on 24 hours a day, that's going to be really important. Also, making sure that you're giving factual information. So I am a huge believer in finding one credible source, whether that's the CDC or any other source that you prefer, and sticking to that as being your primary reporter is important. And also kind of going over the guidelines. So what are ways that you can actually protect yourself from the virus, and what are ways that aren't actually going to be helpful in any way. Also being able to have an open discussion where you are allowing your children to feel comfortable asking you whatever questions they have. So that way you can kind of get a sense of what's going on in their head and what are their concerns and address them in that way. It's really important to validate any emotions or thoughts that are coming out, like really adopting the idea that there's no stupid question. Because once we kind of start saying like, oh, come on, like that's not realistic, or even like minimizing some concerns as, oh, isn't that a first world problem, or things like that, can really kind of keep a child, especially a teenager, from sharing anything further. And that's going to cause them to bottle up, and you're kind of increasing the likelihood that depression or anxiety will occur if it's not already present. So being able to have that open discussion where it's safe and everyone can talk about it, and but also keeping that limited, so you're not spending all day talking about it. And also kind of just really recognizing what kind of anxiety are you kind of modeling to your children. So if you're feeling really, really anxious about it, your children are going to be looking at you for what to do, and they're going to also become really anxious about it. So modeling the appropriate coping skills is going to be really huge. And even coming up with a family plan of what are we doing to protect ourselves from the coronavirus, and sharing that with everybody, and even creating a visual, like either like a piece of paper that you post on the refrigerator or something like that, so everyone knows what are the precautions you're taking, why you're taking them, and then how long you're going to be doing this for. As much information as we can give in an age-appropriate way, I think is going to be really helpful, because information makes us feel like we're more in control, which kind of decreases some of the anxiety that we have. There's great resources online for how to talk to your child. So you can always do a quick Google search of talking to my 7-year-old about the coronavirus, and a lot of really great, credible sources will have really great recommendations for you.
Absolutely. And I know that the International OCD Foundation has done an entire page now on coronavirus, and they talk a lot about anxiety, OCD, how to navigate it, how to talk about it. And I think the takeaways that Dr. Sequeira is sharing are critical, right? Which is that information is key, right? Knowledge is power, but also an appropriate amount. I think for all of us, if you live with health anxiety, for example, you know that Google is your worst enemy, right? Because the more you Google, the more you get stuck and the more you get lost, and you're sure that you've got 1,000 different illnesses and it wasn't helpful anymore. But for some of us who don't have health anxiety, you might love Google because it really allows you to have some knowledge or information that you need in that moment. So it's all about balance, and our job as parents or as adults, as mentors, is to balance that for our children because they have difficulty balancing it themselves. And so knowledge is key, but a limited amount. I also think it's really critical that what Dr. Sequeira was sharing, which is that we don't minimize our concerns, right? Some of my concerns right now are 100% first world problems, but it doesn't mean it's still not a problem for me right now, right? It may not, in the scheme of things, like you could easily minimize it, but it's still a shift for me, and it's a transition, and it's a change that I'm having to deal with. The last part that I want to share is, I think, really important for us to talk about and just end with is how parents can start to know and manage their internal thermometer to appropriately take care of themselves, right? So last night, yesterday was the first day for me so far that I was really struggling. Like, I started to go stir crazy, and it was about 5 o'clock, and I was like, I don't know if I can handle this. This is not for me, right? Like, I'm used to going to my gym, going to my office, being around, like, it's just very different. And by about 6 o'clock, I finally said, you know what, I'm going to sleep. And my family was like, you're going to sleep? Like, it's 6 o'clock. And I was like, well, I'm going to my room. And I knew that I needed to remove myself from people. Like, I was just getting more worked up, and I was talking about it more. I couldn't get out of the loop, and I had to take care of myself. So for me, that looked like going in my room. I took a bath. I relaxed. I still did some email and work, but I just kind of had to put myself in a new environment, new situation, and take a breather. How important and critical is it for parents? You know, I think we often forget about taking care of ourselves when we have so many people dependent on us, but how important is that, and how can parents do that? Any tips for self-care for them?
Definitely. I'm a very big believer in you can't pour from an empty cup. So if you are wearing yourself thin, then you're not going to be able to be there and be as supportive and as loving and kind to your children as you would if you were taking care of yourself. So growing up, I remember, like, once we got home from work, Mom got like 30 minutes of time to decompress. And that kind of modeled it for me, of being able to recognize, like, it's okay for me to say I need a break. It's okay for me to take myself away from a situation, go read, go do something that will help me relax, and then come back to my family refreshed, renewed. And I always got to see her do that. And that was huge for me to be able to have that life lesson. And I think being able to do that for our kids is important. So if you are recognizing that you are getting stressed, overwhelmed, like, I will encourage you to vocalize that. So you're kind of modeling that, that it's okay to acknowledge your feelings, that every feeling you have, every thought you have is valid. You're allowed to feel and think whatever way you do about a situation. There's no problem that's too big or too small to be upset about. But you're also kind of teaching them that it's better to express that and to do something about it than to bottle it up, pretend that you're fine, put on that mask, and kind of wear yourself out thin. So I always encourage to have a list of coping strategies. So it could be listening to mindful meditation, taking a bath, going to work out, journaling. So that way you have a go-to list, because when we feel stressed and anxious, it's really hard for us to think about what to do. And so if you have that list, it's really helpful there. Also, maybe as a family, having a resource list as well. So who can you contact if you need support and don't feel like you can share that with your family? So the National Suicide Support Line, Crisis Text Line, the Anxiety and Depression Association of America, IOCDF, places like that. Where can you find support for whatever you're experiencing. So that way you're not keeping it bottled up. You're going to get immediate help if you need it. Kind of just being able to just talk about mental health and the importance of it as a family, and really kind of destigmatizing it, I think is going to also be really helpful.
It's critical, so I always say for self-care, schedule it. It's okay to have appointments for yourself. I'm a big believer in that. I used to let people know, oh, sorry, I can't meet, at 6 o'clock in the morning meetings. Some people do want phone meetings that early because I work out during that time. And I realized that the reaction wasn't always what I wanted. Some people would say, oh, well, then you can move it, or oh, that's not. And it was no, I can't. That's important for me, right? That is my time. And so it's also okay to say, I have a meeting right now, if that meeting is you taking 30 minutes for yourself, right? It is okay to say that and to do that. And I think that the second piece that Allie was speaking about is critical, right? It is so important for all of us to remember that our troubles, our anxiety, our OCD, our depression doesn't pause like the rest of the world has kind of paused during a pandemic like this. In fact, we often see it increase, and we see symptoms become exaggerated for different reasons, right? We're stuck at home, our thoughts are more pronounced, we're struggling with contamination, whatever it might be. And so it's absolutely critical that you understand that support and resources haven't stopped. They still exist. Mostly all of us in the mental health world are doing teletherapy. I know myself and Dr. Sequeira at our clinic, the McLean OCD Institute of Houston, we are offering teletherapy. We do it intensively, we do it individually, and most clinics are, whether it's Rogers, McLean, your individual outpatient provider, they are not saying, therapy stops during this time, when life resumes, we'll resume. No, we're continuing the work that we do because we also know this is when we might need it the most. My push to parents is, the biggest thing I see parents do is make excuses for why treatment should be postponed. We're too busy, school's in session, we have sports, their birthday's coming up, there's a holiday, we'll make time for it later, we'll deal with it in summer. And what we find is that life's always busy, right? It never really slows down, there's never the perfect time. There's not really a better time to start treatment or do things you've been putting off than right now. Like Dr. Sequeira mentioned, it doesn't matter if that's learning the piano, it doesn't matter if it's learning a new language, or if it's finally seeking mental health treatment that you've been putting off that yourself or your child might benefit from. Please visit iocdf.org, visit peaceofmind.com, email us, get resources, get support, because the most important message I want to leave you with today and every day is that it doesn't matter our situation, it doesn't matter our circumstance. Help and hope are always available.
Yeah, and a lot of psychologists are also offering pro bono and treatment at a reduced rate. So if cost is ever an issue, contact organizations like the Texas Psychological Association or the Psychological Association for whatever state you live in, and they can probably connect you with somebody who is providing that service. I think oftentimes finances is a huge barrier, and so I want to let people know that there are a lot of pro bono and reduced rate services available right now. So you can always find those too.
There absolutely are. And of course, there's support groups, there's treatment groups that are reduced rate and sliding scale. There's always options available. So thank you so much, Allie, for joining us today. We are so excited that you were able to give such great resources to so many. And there is a question that I'll kind of end with, which is that, is it possible for my children to have OCD if I do? And absolutely. We know that OCD has a genetic component. We know mental health conditions often have genetic basis or roots. We don't know exactly what that is, but we do commonly see OCD within family systems. So again, remember, treatment for OCD, treatment for anxiety, whether you're a child, an adolescent, or an adult, it's effective, it works, and it exists. Visit peaceofmind.com and iocdf.org for more information. Thank you all, and we'll talk soon.